What's up, guys? This is Trevor from Unprofessional, your host. I have a different podcast for you today. We talked to Roshni. She was a former medical student. Now she is more of an entrepreneurial type person. And she's doing work out there. We have a bit of a discussion about medical school, what it was like, how hard it is, stuff like that, different experiences we had. One where she straight up had a literal nerve breakdown. And then I talk about the schedule and different difficulties. And we also disagree on pretty much everything else in the world. So that's interesting. And we disagree on the vaccine, what it takes to put out the vaccine, how people should respond to it, and everything else. Modern medicine. We talk a little bit about some history of medicine, which I don't even know if we ended up agreeing on that, but yeah, it was good stuff. It was an interesting conversation for sure. And I respect her. I think we had mutual respect, and yeah, it was a good time. I think we both had a good time. So enjoy the podcast. It is a special one. I'm a medical student. I'm from the United States. I grew up in Minnesota, and I currently am at medical school. I went to St. George's University. We are an international medical school, so we're in the Caribbean. That's pretty much for people who aren't able to get into American medical school. So either have bad grades or a bad MCAT, or, you have some kind of we have people who assaulted people, or, just couldn't, something was a bad look on their application. But so, we have the whole range of people there. And I'm currently in New York. We do our clinical rotations afterwards, and so I'm here. And then, that's about it.
Okay. So tell us something that surprised you when you were studying medicine.
Something that surprised me about studying medicine. First things first. The vast array of information you have to know as a doctor is intense. I knew it was going to be a lot. I just didn't realize how vast it would be, and how really not even that, but how much you have to study every single day to be able to put it into your brain, especially if you're not a smart man or woman. Yeah. You have to just work extra hard, and not even extra hard, but just long amount of time each day, and it has to be your main focus. You have to sacrifice a lot of things to be able to do it. So that was the biggest surprise. There were others too, but
yeah, but I remember the first time I was in med school, and then 2 weeks after, it was like a good relaxing 2 weeks, and then we have exams already.
Right. Yeah, we especially for St. George's and other international medical schools, we get almost zero break. Not to go all boohoo, but it's pretty much you don't even get a weekend, because your exam is usually on a Saturday. Yeah. And then you have Sunday off maybe, and then you have to start studying. I start studying the next day, but you have to start studying at least starting on Monday for the next exam, so it's pretty intense for sure.
Yeah, especially in the final, the most difficult subjects will be placed all together, and that would be a huge risk.
For us, it was just completely random. They would just randomize the whole test. Essentially, so you try to get little themes and stuff. Oh, maybe this is where the difficult questions are and stuff, but not really. You just got to kind of skip the hard ones at first and go to the easy ones, so you can get that credit down, and then you can go back to the hard ones. But there's a whole strategy to taking tests, which is honestly annoying as hell, but
yeah,
you got to learn it, otherwise you're not going to.
Especially the MCQs, they are really tough. They're not simple MCQ answers, and all of the options are pretty similar, and you don't know which one to take.
You guys do questions that aren't multiple choice questions? That's all we do.
Yeah, most of them are multiple choice. For anatomy, it's a huge blank.
I see.
So it's we have 3 questions from 3 parts of the document, and we have to pick at random. So imagine like you skip some of the topics and then you just grab it, we have to like close our eyes and like grab a topic.
Mhm.
And imagine if you just take one that you didn't even look at.
Wow, yeah. No, I mean, anatomy is something for sure.
Okay, so I will tell you something that surprised me was the dead bodies. Like,
Mm.
because I told you I had an anatomy teacher. He was like really funny, and as a friend, he was like a good person. But as a teacher, he was horrible because he was a surgeon. Yeah, yeah, he was a surgeon, and I think that he couldn't balance the two jobs as being a teacher and a surgeon at the same time. His 2 minutes been 3 hours. So yeah, and he never actually completed the syllabus for us. So it's like it's a lot of self-study. So if imagine there's like 50 topics to
Oh
study.
man,
But
that's all the medical school is self-study. I
yeah,
mean,
yeah,
especially international medical students. I mean, you just don't. They give you lots of resources. They just flood you with resources and go, here you go, learn, and it's
yeah, but
great. You have
yeah,
everything you need, but it's like you're on your own. Whatever relationships you make with your friends and stuff, that's all you got.
that's all you got exactly. And like I don't know, our teacher was didn't even give us any resources. Like he
Oh
was,
wow.
yeah, he was just telling about his experience as a surgeon, and patient to doctor confidentiality is supposed to be there, but he
Mm-hmm.
just goes and like shows all the patients he has to
Mm-hmm.
deal with and like the cases, and which was really funny because you're supposed to keep that a secret.
Mm-hmm.
And
Yeah, I
then
mean those kinds of things happen all the time. I
yeah,
mean, luckily a lot of them are like, less crazy and, teaching medical students with like images of your thing is probably, I mean, that's you're not hurting that many people, but I don't know. Maybe he had permission. I don't know.
yeah, I we don't know. And then we were asking questions from each other. Like, did he ask? Are you
Mm,
sure that he asked? I'm not sure, but
mm,
he asked
mm-hmm,
the patient. And then
mm.
like he would tell us stories about a person he was playing. Like he was like having a sword fight, and his the sword.
A sword fight. What
Yeah,
are
a
we in like
sword.
1800?
I don't know. So his opponent kind of like put his sword right through his brain, and he started walking to the hospital in the university. So that was the story he was
It
telling.
happened at the university?
Yes.
Where did you go? Hogwarts or something? What is this?
This is in Carol de Villa University in Bucharest, Romania. So he was
Okay.
walking, and
Do you
yeah,
guys
he
have
had bloody.
vampires too? What the heck?
He had a really bloody head, and we were wondering what's happening.
Uh, yeah, I would be wondering what's happening too.
Is it
Did they have like a
Halloween?
duel? Was it like
Yeah,
for their honor or something?
I have no idea. Was it
Oh,
Halloween? Is it a surprise nobody told us about?
those would be my first questions. Not like how much blood have you lost or anything like that. They'd be like, wait, was this for honor? Why were you doing this?
And that was actually a real case. And then he told us that his brain was slightly damaged, but
Mm,
they managed to like save the sword. I was like, what?
that sounds like he's just joking around.
Yeah, and his ringtone was all about Star Wars, like the Star Wars theme
Mm,
song. So imagine every time it rings. And I used to get annoyed because a day after the exam, he shows us the dead body. So we had like three options. So option one is probably stay back in uni and wait till everybody close the doors, lock the doors, and off the lights, and then we go straight to the basement where the dead bodies are, and we study till the next day. That was option one. Option two was like go into like a graveyard and start digging, but none of us wanted to go to jail because grave digging is illegal. And then option three was where the our teacher said no pictures on social media, especially of cadavers. And
mm,
what we did was, so we thank God Facebook was still there, so
mm.
we created a secret group and we call it Anatomy.
Uh, very, very dramatic.
Yeah. And then we put all the videos, and it was like, yeah, we couldn't sleep, and we could, yeah, we studied everything for the next day. That's how we
Yes.
passed anatomy.
Yeah, sometimes you have to really go off in medical school. It's funny that you mention it though. One thing that when they first started doing anatomy, it was like frowned upon so much way back when, like in medieval ages, I believe, or somewhere, or maybe it was like the Renaissance era.
It's
And
18th and
they,
19th century, I think.
yeah, wait, which?
18th and 19th century.
I think that's too late. I think it was earlier than that. But I'm talking about when they first started doing it.
Okay.
Um, but they said, yeah, they had to like dig up bodies and stuff because it was so frowned upon by the church and all that. So, and they'd have to do it in secret for real. So, yeah, I guess you were kind of paving the way there,
Yeah, I also heard
following
a
in
story.
footsteps.
Yeah, also heard a story that one of the doctors used to say in the uni was that med students would go to actual graves where black people were buried. So when they dug those bodies, there won't be much of a commotion because it wasn't a white body
Right.
that was stolen, it was a black body.
Right. You'd go to like poor people, yeah, like people of color, that kind of stuff.
Yeah, so no, it wouldn't be a big deal. And
Hmm.
they were, so what the med students were doing, they were like grave digging for a while until white body was lost.
Hmm.
And
Yeah,
then,
Galen. That's the name I was looking for. Galen in the second century.
oh,
He was kind of like, I don't know. There was others before him a little bit like in Egypt and Greece and stuff, but he was one of the first ones to really hit it, you know. Like there's still like veins and arteries and stuff like named after him. I think it's like one in the brain. It's like Galen, I don't know, something vein. It's the one that goes across here. But anyway.
yeah, that's super interesting. Do you have
Hmm.
any COVID-19 stories?
So when we started, I mean, first of all, yes, I do. But we were like immediately after like that huge surge came in right away,
Yeah,
when it started. So we were actually kicked off of the island, in Grenada, where our school is. They like told us, all right, we're gonna put you on these flights, go home. So it was like this crazy like evacuation. I had a motorcycle, I had to sell it in like 24 hours, like all this other stuff. So I'm like, oh my God, it was crazy. Left a bunch of stuff behind. It wasn't like crazy to leave stuff, but then so we go home or whatever, like all this COVID stuff happens, and then we enter clinical rotation. So then I finally get to see the COVID, right? And I don't know, it was kind of weird because I expected it to be like just like crushing amounts of people, but what happened was immediate right after the surge, where I mean every emergency department was just packed. Like they tell me stories at the hospital I'm at. um they, I mean, first of all, filled the ED obviously, and then filled like all the hallways of the ED, and
yeah,
then filled the lobby of the hospital. And if you
yeah,
know what the lobby looks like, you're like, oh my God, it's like an auditorium, you know. So
yeah,
I mean, I just imagine that and it's like, holy crap. But and then but when I got there, there was less people than there normally is attending the emergency department, like on an average day when there wasn't COVID. And I was like, what is happening? Well, everyone's like afraid to come to the hospital because our hospital was one of the first to get like COVID cases
yes,
in New York. So then like no one wanted to go there. Like, I'm just gonna go and get sick, which I mean, they're not totally wrong, but they're not, you know. I would be afraid to go there too, you know. Um, but yeah, so that's pretty much it. Now I just see COVID cases where, you know, they aren't vaccinated, so it's either more severe, or, you know, so that's kind of sad to see. And then if they go into like respiratory distress, that kind of a thing, then we have to put them on a ventilator, and that's, you know, where things get kind of complicated. But hopefully they don't. If they don't have to go on a ventilator, then, you know, it's not crazy, you know. Hopefully they recover soon. But yeah, it's usually like the complications and stuff where you get really worried. So
yes.
yeah.
Yeah, so but like I told you, like right before the pandemic, like 2 years apart, like I switched courses. And yeah, so it's kind of like I still have like information about vaccines and stuff like this, yeah, like because I learned all of that during when I was studying for medical college, and then during medical college we got to take a look at it as well. So I was thinking a lot to myself, okay, COVID-19 exists at the beginning, and there are so many cases. I saw some social media pictures from doctors itself showing cases of COVID-19, because people were actually being skeptical of the disease at first. And then after that, I heard stories like from my friends who are the medical students, and they were saying when they go to the hospital, it's like someone who died of diabetes being recorded as COVID-19 deaths.
What do you mean?
Someone who died of diabetes gets recorded as deaths from COVID-19.
They were just lying?
Yeah. And it happened, it happened, this was in Romania, it happened, some of them in France, and also back in Sri Lanka, like a priest we know, like really well, he died of a heart attack, but it was recorded as deaths from COVID-19.
Well, here's the thing. So, for instance, I am doing a research case report on COVID-19 related like encephalopathy, which is like altered mental status. So, it's something affecting the brain, and the person is like confused, agitated, that kind of a thing for multiple days. And in this case, we did imaging, right? So then we saw that there was like bilateral, which just means both sides, hemorrhagic, which means blood,
Yes.
and then in the brain, right?
Yes.
And we're like, okay, what could have possibly caused this? We went through all the things, right? We went through, okay, it could be, I mean, he was low on platelets, so it could be immune thrombocytic purpura, right? Or and all these other things, right? I won't bore you with details, but I mean, we went through it systematically, figured out everything that it could have been, ruled out all those things, and then we got it down to like, okay, it's one of these two things. It's either due to trauma from when he fell and hit his head when he had the seizure, right? And the other cause is COVID-induced hemorrhagic encephalopathy. So, I mean, we looked at what is most likely, and then we decided that it's most likely secondary to COVID-induced hemorrhagic encephalopathy. So yes, it's still possible that the trauma caused it, that kind of thing. But just likelihood-wise, that's probably the most likely cause. And we'll learn more about COVID and that stuff. But I mean, that maybe initially there was confusion among COVID, and I can't speak for all hospitals telling the truth and that kind of a thing. I'm just saying that over time it's more understood, and then we learn that there is major issues with that kind of an illness, you know what I mean?
Yes. And
so like, I'm afraid, the only thing is I'm afraid of when those stories are like mentioned, which they're probably true. I'm just saying, when those stories are mentioned and put at the forefront again and again and again, then people start to think that the illness isn't real, or that it shouldn't be taken seriously and things like that. And not that we should stop everything we've ever done and start doing, all this stuff for COVID. I'm just saying that take it seriously. I mean, this has killed more people than influenza.
Yeah. And the thing is that, but another case is like from a guest I had from another podcast, is that in the early days of COVID-19, his mother actually died from cancer, and still they recorded it as death from COVID.
And here's the thing, there's a lot of confusion at first. For someone to be completely sure of something, first of all, you have to say that there's like a cause of death. And I can't speak on that case specifically, but I mean, how do you know what it's specifically caused by when you just learned that this illness is a thing, like whatever, 10 days ago? You know what I mean?
So like
to expect people to be 100% confident in something right away, I mean, it's just like, come on.
Yeah, I know. And it wasn't like 10 days, because she's been having signs of cancer for like a pretty long time, and he was that.
And here's the thing, for all we know, and sorry, I interrupt you all the time, I'm sorry. But for all we know, the COVID maybe was like exacerbating things. Maybe she died of, I'm just guessing, I'm just saying it's a random thing, congestive heart failure secondary to COVID, right? And maybe the cancer was like helping cause that too, so it could have been either one. So you just have to declare something end of the day. Man, maybe they said it was more vague, like, oh, COVID,
it's most vague,
cancer, blah 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 blah, right? I mean, it's just
and it was like, that's why the numbers are like not accurate, I presumed. And but the illness, that doesn't mean that the illness is fake. The illness is just there. And
Right. Right.
that's what I deduced by the end of 2020, is that the illness is there, because
Mm-hmm.
everybody is saying that when they're going to the hospital, they see patients, and they're seeing the cases and for their own eyes. So then I was like,
Mm-hmm.
okay, then it's believable that it
Mm-hmm.
exists.
Mm-hmm.
It's just that when they deduce the result of the death, there is a, yeah, for some
Sure.
cases, yeah.
Sure. That's
And
fair.
so there are very outliers in the statistics.
Mm-hmm.
And did you also learn vaccination in med school?
Yeah, of course.
Yeah, you can go through the steps.
What do you mean? You mean just like approving pharmaceutical
Yeah,
things over
yeah,
time?
yeah.
I mean, it's more of a step one thing. It's like there's like what 4 or 5 phases or something,
Yes.
and they just go through different stages of testing.
Yeah, it takes
And
some.
it's anyway, it's just like a very rigorous process, and you like start slow and like theories, and then you go to like animals, and you eventually end up with human subjects, and then you finally are like putting out to the public, and even then you're doing like research on the effects and stuff, right?
Yeah, and normally it takes 10 to 15 years. Like for
Right.
drug or vaccine is a similar procedure.
Mm-hmm.
Like phase one is like yeah, it's like preclinical trials is based on animal testing, and clinical
Mm-hmm.
trials are on humans. First, they test it on like 10 to 100
Right.
healthy individuals. Then from 10 to 100 patients who have the condition itself, and then 300 to 3,000
Right.
around. And the first phase can take like a couple of months, and the second the second phase, when they're testing it with humans against a placebo effect, it might take about almost 1 to 2 years. And then
Mm-hmm.
finally the large group, where the large group of patients have been tested, where the drug has been properly distributed throughout the body and
Mm-hmm.
excreted, that also takes another 3 to 4 years. And
Right.
then it should, at each stage it should be approved by the FDA. Then you have like
Mm-hmm.
two applications, like the IND application and the NDA application.
Mm-hmm.
And then then it goes to the marketing phase.
Mm-hmm. So point being, COVID
Yeah,
vaccine did not go through this rigorous process
yeah,
completely.
yeah. None of the COVID vaccines actually did, and then Cypher was approved
Mm-hmm.
recently. I think because it was like the most effective, but obviously every like drug or medication has like side effects.
Mm-hmm. But as like medical professionals, like we know what it is, and
Yeah,
we know what the side effects
yeah,
are, and we know that the side effects or the possible complications of the vaccine are way less than
yeah,
the
way
benefits
less.
that are
Yeah,
going to be
yeah,
helping.
yeah, yeah.
Yeah.
That I can agree, but
Mm-hmm.
but normally when there were examples back in history, like when it surpasses a number, it was taken out of the market. Like especially the number of deaths and the number of side effects that people encountered.
Sure.
After, yeah,
Yeah, but we're not talking about like, Viagra here. We're not talking
yeah,
about
yeah,
like dick bigging pills. Like
yeah.
we're
Like
talking about reducing complications to a
temptation.
virus that just came out that's like been very bad, to put it
Yeah,
lightly.
yeah.
It's been killing lots
Yeah,
of
but like
people.
some people think that it depends on fate, it's whether you get it or not, and it's like something you can't see.
It depends on what? Fate?
Yeah, fate.
Okay, sure. Now we're going to different territory, which
Yeah,
I mean, for sure. Like there's
yeah,
definitely people who believe that, and probably a lot. So
yeah,
that, I mean, I don't know how that's a job for I don't know, whatever the FDA or whatever government agency is
yes.
in charge to try to.
And sometimes this is a virus like nobody can ever see,
Mhm.
so it's like invisible.
Right. Huge part of it. Because I mean, if you could see that your heart like stopped beating or some shit, like you're worried, right? You're
Yeah,
like, we need to fix this, and we need to fix it now. Like, but this
yeah,
is a
and
virus. It's smaller than bacteria. Like, it's
yes,
insane. You
yeah,
can't
and
comprehend it.
I think there was more fear than anything else during this pandemic,
Hmm.
and that's
Oh,
what.
huge. I mean, it spread so many things. And another like medical history thing that I can bring this to is like, this was like 150 years ago, which may seem like a lot to people. It's, and
in the whole grand scheme of things, not at all. But that's when we first started learning about bacteriology. We didn't even know about viruses yet, and they didn't clean anything. They didn't do any of that when doing any of this. Nothing was sterile. Now we do the whole, you got to like wash your hands multiple times. We do gloves, then we do sterile gloves, and then we like drape the thing. We like iodine it. We do all of that just to put a little like line into your femoral artery. You know what I mean? And back in I think it was Vienna or something in like 1850, they were doing autopsies on dead bodies that you were talking about earlier, and then they'd go directly to the birthing ward and then have babies come out, and then all these moms and babies are dying, and they're like, why is this happening? And then it kept happening, and then the one of the doctors or the main guy is like, all right, we're going to start like washing our hands with chlorine, right? And that was mostly just to get the smell out. He's like, maybe that'll help. And so he had no idea that it was going to help, and it did. All the deaths went down, you know? And so that, I mean, that's huge. And I mean, point being is you can't see this stuff. They don't know about it yet. And so that's like the average person today. They just don't comprehend what is going on there. And until you do, you can't convince anyone. In fact, last point on it, in 1850, when he was trying to convince physicians with all this like, you know, knowledge that and he didn't even know about bacteria yet, but he like, look, when you wash your hands with chlorine, it reduces deaths. No one listened to him. No one gave a shit. You know, so he couldn't even convince doctors in 1850 that I was a thing. Like, how are you going to convince the average person today? You know, it's tough. It's tough is the bottom line.
Yeah, it is tough. Especially it's tough to be like a doctor, because the thing is that everybody's being skeptical of, they think that there's a conspiracy plan behind it, which I doubt.
Which there's great importance to being skeptical about things, but then once you learn that you shouldn't be, then you should stop being skeptical of it, right? I mean, it's just not beneficial to you anymore.
And here, I don't know, like a lot of doctors went on strike because they didn't have the freedom to speak about it.
Oh, what? Really?
Yeah.
Really? I didn't hear about that, but okay. I'll take your word for
it. Did you hear anything from the US?
Honestly, bottom line, med students, I mean, I'm sure there's some that are really connected to current events and stuff, but a lot of us are just dug into our books. So but no, what was the thing?
It was medical freedom strike.
Okay. No, I didn't hear about it. I heard a lot of like people quitting because it was so intense. Like there was just so many people, and it was just so taxing on their lives. Like, physicians, nurses.
Yeah, but it took a pandemic to actually for them to go on strike.
About medical freedom or about the stresses of work?
Yeah, medical freedom.
Okay.
Yeah. And then because they were, I think.
What do you mean medical freedom? So it's like the ability to talk about the things, what things were being held? I don't understand.
Like, because when they mandated vaccines, it's like some people were.
Oh, this was after the vaccines came out. Okay.
Yeah. So some people were against it. Some people were for it. The people who were against it went on strike.
Sure. That's fine.
Yeah.
I mean, that doesn't worry me that much. I mean, I think that there's always going to be people skeptical of things, even in the field that they research it and stuff. Like, that's just how it goes, you know?
Yeah, because there's like a huge story, and then there's a debate about certain things, and
right, that's good.
Yeah, sometimes when we approach like a new experience, it's like even we don't know the answer until we get to the final.
Right. It's tough. Yeah, it's tough. I mean, like science is always changing, right?
Yeah.
But to say that we can't trust it because it's always changing, I mean, we've made so many advancements. Like, you're just going to disregard all of them. Like, what are we doing? What are we doing here?
Yeah, we can't forget about all the successes we had in the past.
Right, which has been numerous. I mean, that's why everyone's alive. I mean, there'd be like 20,000 people, not 20 billion.
Yes. So there is a huge argument going, and what happened here was that as soon as they mandated vaccines, I think so many educated people were on the streets, like even lawyers, and because they were against it.
Sure. Yeah. I mean,
and it was like more than 5,000 people on the streets
in this strike. Sure.
Yeah. So did you have any interesting experiences you want to share in your life, like in medical college?
My life in general? I mean, the biggest one I've already talked about is, I mean, I was not a dumb kid, like I have street smarts and such, but I went into undergraduate school with very basic understanding of how to study, and just science in general. And man, I struggled through classes, and I didn't know what I should be doing, how to do it, in anything. And then so I just squeaked out good enough grades. I just worked my butt off at the end of undergrad, and then when I got to I got, I applied for medical school not expecting much, and then I got into an international medical school, SGU, and they took me in. And then I just put in tons of effort. I mean, the thing is if you aren't good at something and you want to be good enough to be one of the best at it, that's all you can do. So that's all you can do. So that's all I did for like 2 years. You sacrifice everything else.
Yeah,
I mean, it doesn't
I
have to
know how
be,
it
you don't
feels.
have to like kill off your family members, you know what I mean? But you can't talk to them all the time, and stuff like that. So everything is that. And yeah, that's just kind of how it goes. So I mean, that was pretty much it. I mean, yeah, there was a lot of kind of wild experiences along the way. I don't know how I don't know how unprofessional you want to get on this thing, but
Yeah,
but
it's
yeah.
fine. It's fine. Like nobody's perfect. At the end of the day, even I kind of like I tried so hard during the few years of high school.
Mhm.
How old are you, by the way?
I'm 27.
Okay, I'm 26. And I actually tried so hard during the final years of my high school. And the thing was like I was like aiming to go to UK,
Mm,
but they weren't even giving scholarships, so it was like expensive for my dad to afford at the same time.
mm,
So the competition was incredibly high for the English speaking countries, so America, UK, and Australia. So
mm,
I was aiming to go to the UK, and I couldn't make it because I didn't. The university didn't have enough seats at the end of the day, and plus
mm,
I had to get a visa and stuff like this. And some of them were who actually applied for UK university cities actually got rejected by the visa. So
mm-hmm. Visas are a huge deal
if,
with all that.
yeah,
Even my Canadian friends, I mean, it's just tough. It's tough.
yeah, it's really tough. And then after that, I aimed for Europe, and I got a scholar to one of the best universities in Romania. So it's
Nice. Well done.
medical universities. But like I told you, like I didn't expect it to be like that tough. I I knew it was going to be like
It's
I had
wild.
to work. Yeah, I had to work hard, but I had like no idea of what I was
Right.
getting into.
Until you experience it, you don't know.
Yeah. And you think that it's a bit harder than high school. I think that's the image you get at first, but it's like a huge jump.
Yeah. Yeah. I mean, yeah. A marathon's a bit harder to run than your mile run at high school for sure.
Yeah, and then it was like a huge jump from high school to the first year of med school.
Mm-hmm.
And I remember like 2 weeks I was just relaxing, being the leader
Oh
in the
yeah.
group.
Mm-hmm.
And then I was like, okay, I'm getting everybody's contacts, emails, because everybody was too afraid
Yeah,
in the
that's cool.
beginning. So yeah, I actually came very close to the teachers because like I was always in the front.
Mm-hmm.
And yeah, I was like not afraid at first to approach them and all. And then like 2 weeks later, oh my God, we have exams.
Wild. I know. Yeah. I mean, it's all about the exams. So, I mean, and yeah, contacts and everything are important too. But I remember I just sacrificed all. I'm like, no, none of that matters. My numbers matter, and that's it. And I mean, that's kind of part of it too. I mean, like number one is what you get on your MCAT step 1, step 2, like that comes first and foremost, and then everything else, except apparently in Canada, to get into medical school, it's like interview is huge. It's like 50% of it or something. At least that's what my Canadian friends say.
Yeah, and it was like I can remember that I don't know, like the first year went out smoothly. The second year, I remember that I was studying for like a really important exam, and then I had really I had so much of anxiety in me. Like I could like
It's
it's
crazy.
so much like see, and
It's crazy.
you can't even balance it your academic life with this having a social life. It's like I had to
Hmm.
not sleep for 3 days in order
Hmm.
to actually go to a club and like enjoy a girls'
Hmm.
night with my roommate and her friends. And
Yeah, I had a friend who actually pooped his pants on the first exam.
oh my
Genuinely pooped his pants during the first exam. What do you think he did? What do you think he ended? It's the beginning of the exam. And he poops his pants. What
God.
would you do?
Oh my God, I would like immediately excuse me, I need to go.
Right, right. I don't know what I would do. But you only have 3 hours to do this exam and you have like 120 questions or something. He just finished it. He just sat in his poop and finished the exam. He did very bad. He did much better later. He's very smart, but yeah, it's crazy.
He was, yeah. So one day I can remember I woke up, I
Mhm.
stood up. It was around like 5 a.m. in the morning, and
Mm,
I remember I had the exam at 8:30. Okay, and
mhm.
all of a sudden my legs stopped working, and I fell down.
That's crazy. That's crazy. I never had that. That's insane.
And then I was like having these like those black blobs all over. Like I was seeing these black blobs everywhere.
Mm, mm,
And then I was like, oh my God, what the hell is happening to me?
that's crazy.
My roommate was asleep. So
Mhm.
I was like, oh my God, I can't move. I can't feel my legs.
That's wild.
I and I don't even drink. I don't drink at all.
Mhm,
I was only high on like coffee, I think.
mhm.
It's like
High on coffee.
cappuccino.
Yeah, I get fucked
Cappuccino.
up on coffee every day.
Cappuccino. And I drink about like four cups of coffee the night before, and so I don't know what exactly happened to me.
Mhm,
So I was like, oh my God, this is definitely due to the anxiety I was feeling.
mhm.
And what I did was I was crawling to the bathroom, and like I was like dragging myself.
Jesus.
Yeah,
Like Civil War era, you got like
yeah.
hit in the leg or something. Jesus.
I
Okay.
was like dragging myself on the floor, like at the legs especially. And then I managed to like open the door
Mm,
and try to stand up because like against me there was a wall and then there was a door to the bath toilet,
mhm.
and I was like trying to stand up. That's the first thing I tried to do, like hold on to the doorknob as like a support system to lay my back on the
Mhm.
wall.
And you stood up just fine, right?
I could feel my legs. It's like my legs were numb,
Mm,
like
that's
something.
crazy. Yeah.
Yeah,
What do they call it? It's like somatic I don't know. I don't know, but yeah, I mean it's a real thing.
yeah. It's like someone shot me in the spine.
That's crazy. That's crazy. Yeah, I never had that. I know some people who did have things like similar or whatever, but yeah, stress is insane. I mean, I
Yeah.
remember one time I
I
yeah,
remember I was crying on the floor. So while doing
oh,
that,
I bet. I'm sure. I would be devastated.
and then I was like, oh my God, I had to make my legs start working. Okay.
So
If
like
I
pinching them.
Yeah, it's like I can do this, like my legs are not working. I don't have to stay in for the rest of my life in a wheelchair. And I was like contemplating about life. Still I can see black blobs everywhere.
Damn.
I can't see like even where I'm going properly, but because of the experience, I think the surroundings were like
Hmm.
kind of familiar for me. So I was laying my back against the wall and like holding on to the doorknob to make myself stand. And what happened was I tried to puke.
You purposely try to puke?
Yeah,
You like put your finger down your throat?
yeah.
All right.
Put my finger down the throat and like because
Interesting choice.
yeah. But what I did was I thought that it must have been something I ate or something. So
I don't know
I
about
don't know. I don't know.
that.
Like
Interesting thought.
yeah, I was like, must be
You're
something
like
in the
panicking,
coffee.
yeah.
Yeah, maybe something in the coffee. Maybe
Sure.
something is inside. And I just puked. Okay,
Okay.
because like in the movies,
Sure.
yeah, it's like that's the only thing I could come up with
Yeah.
at
That's
that time.
hilarious. Uh-huh. And did you
So
puke?
yeah, I puked, and after that, um, the thing is that I couldn't even wash my mouth or anything. It just I was still in the like the entrance of the like toilet. And then like still
You're a
I couldn't
mess.
feel my legs. Okay, I was still
Uh,
crying for like 45 minutes, and I kind of just was late for the exam, but I got my legs to move, and I told myself that I'm going to walk instead of getting a taxi
uh-huh.
or to uni, because it's like 5 kilometers, and it's like I got to make my legs work.
Mm,
And yeah, so gradually I got my legs to work and I was walking.
crazy. That's insane. Did you take the test?
Yeah, I took the test, and I had like this imposter syndrome like way before the test.
Sure.
And like when I did the test, like I passed 9 on 10. So that was the best part of it.
Jeez. I didn't even get that kind of score, and my legs worked fine. So
I don't know,
dang.
like something happened to me. Even like I was supposed to explain this experience on another person's podcast, and they were laughing at what I was saying as well.
Mhm,
And then they were like asking medical school questions like,
mhm.
how many bones do we also have in the body? I can't remember. It's like 213. I was like, I think
Sure.
it's 206. I can't remember. And I was like doubting myself. And when I
Uh-huh.
actually Googled it, it was exactly 206.
That's insane. Yeah, my memory does not work like that. But yeah, I just have the confidence and nothing to back it up. No, I'm
Yeah.
just kidding.
But like,
Um,
no, I feel like, no, every like when I'm doing something like a difficult exam or something, I think like I'm nothing, or I'm an
mhm,
imposter or something like
mm,
this. And then the imposter syndrome just comes in.
mm,
And then actually for anatomy, I was so like my first year, it's like all the other subjects like cell biology, psychology, physiology, I got all my nines. Anatomy, I got 5. And then I cried in the crying room.
in the crying room.
That's what like the students called it,
Uh,
because it's
interesting.
where everybody goes and cries.
Interesting. We didn't have a crying room per se. That's just everyone's own room. You cry in the in the loneliness of your own home.
Yeah, and the thing is that I also had like sort of depression because I came from a really strict culture as well.
So what
So
culture?
a very strict culture.
Oh,
I
okay,
have like
yeah.
strict parents, like
Mm,
no freedom at all. Like I can't take part in the social circle that everybody's in.
mm,
And I can't even like hang out with friends the way other people can hang out with friends
mm,
either. So it was just me. Um, in my childhood, it was like basically me going to school and back home, school, home,
mm,
school, home, school, home, or maybe meet family members, and or maybe go to dinner as a family. But like it was really, I had a really few times to actually enjoy my life with my friends,
mm.
and I wasn't allowed to go to relationships either. And
Dang,
in my family, like the
it's my
way that,
favorite thing.
yeah, yeah, the way that yeah, the way that they kind of treat me was there was like manipulation going on and reverse psychology. So like I always thought bad of myself.
Mm, dang,
Yeah. So
rough.
yeah, so all of those were the building blocks to my depression as well.
I can imagine.
Yeah.
My friend is Pakistani, and he reports a similar experience. Maybe not that intense, but yeah, definitely. He's like yeah, just international or Middle Eastern or whatever, or Asian, like it's just a different culture. Like you're just
Yeah.
expected to just crush it every day. And
Yeah.
if not, you
And
should feel horrible about yourself type thing. I'm like,
yeah.
dang.
Yeah, that kind of thing. And then I had like I recovered from the depression as well. It was like holistic, and holistically I didn't actually take any drugs or actually go anywhere. What I
You
did,
didn't pop some mushrooms and then have
no,
an enlightening
I was like,
experience? No.
no, I didn't have like any plant medicine because I'm definitely scared of that. Like, I feel like people who talk about marijuana, weed, and stuff like this is like some crazy people who talk.
Okay. What about, I mean, there's definitely people who aren't crazy who
Yeah,
talk about it.
I know, because it's like, yeah, they know more about plant medicine than me, myself, and there are
Mm,
specific components of the plant medicine that do not give the high off, probably.
yeah, yeah.
Just uh,
CBD or whatever.
yeah, they just cure the specific disease, but I don't know much about it. So what I did was like, I used to journal a lot and write all my thoughts, like write to turn my emotions into words.
Mhm.
And what I did was like, I wanted to have a very challenging lifestyle because I was always inside the house, and I never actually gone out. And the first time I was living alone, I was like, okay, now I can actually walk outside the streets.
Same thing.
Yeah. And yes, and I could be independent, and that's what I actually liked. My parents came a year later, and then I was like, oh my God, I'm doomed again. I can't go out. I feel trapped.
Mm,
Yeah. And those sort of experiences, and I was like continuously rebelling against them, that I need to actually go on walks and everything. And that,
they should have tied you to the bed or something. They let you get out.
yeah, it felt like that, you know, my whole life, it's like they were tying me up.
Mhm.
Yeah, it felt like that. And do you have any like experiences like this?
I couldn't have less to connect with there. I mean, I'm like the last of a bunch of brothers. They let me kind of do whatever, but had generally high expectations, but nothing was like laid out in stone. I mean, they were, you know, there was times when it was like, look, you know, we're busy, do what you want to do tonight. Just, you know, this is like unofficial, it wasn't said to me, but like just make sure you come back at some point for dinner, and don't be all like hurt or like get in trouble. I mean, mostly just don't get in trouble or don't be hurt enough to have
Yeah.
a hospital bill, you know. And unfortunately I had lots of hospital bills, but I didn't get in trouble very much, so that was good. But no, I can't connect with you very much there. I can imagine that that was very hard experience. I mean, it did make you very smart, I'm sure. I'm not the smartest man in the world, but
But I'm not
now
smart,
I've
I don't consider myself
okay, miss, I couldn't
intelligent.
walk, but I still got 9 out of 10 on the exam. I got 9 out of 10 once in medical school. But yeah, but you know, I've learned hard work over time, and how to study and how to, I guess, be smart or pretend to be, right, enough that you actually like learn enough and you have like the confidence to keep studying. So that's what I've learned over time. I had a great childhood. My parents are awesome. They did their best, and yeah, they're hardworking, and they get it. They get it. And you know, all my brothers are different, and like very different, the whole span from
Yeah.
like, you know, hippie to like me. And they understand all of us now, I feel like. So it's cool.
Yeah, it's like that's something I never had in my family. Like there was no understanding, and I was like the first child, so everybody was expecting like perfection. So
Mhm. Yeah, that's tough. That's tough.
yeah, and then I was trying my best to be perfect, but also like mentally stumbling down.
Mm.
And I had to figure out a way to maintain that sort of brawn within me. So it's like uh,
Sounds exhausting.
yeah, it's like trying to be committed, trying to have like control of my emotions and like how I react to things,
Mm.
and choosing what I can control and what I cannot control, because we can't distinguish that sometimes. And I had to separate that from the rest, and I
Mhm.
had to be consistent.
See,
And
that's
yeah,
kind of a good thing though. I mean, you learned how to control your emotions and stuff, which is great. But since you were like, I feel like since you were forced to do it,
yes,
especially by people that, you know, love you or whatever, like
yeah,
that's a crazy relationship. But also you're forced to do it, so you learn it a different way. Like I had to learn over time. I'm like, look, I don't have to do anything, but if I do control my emotions, do things this way, am charismatic in this way, do this, then people kind of do what I want. Or like, you know, we come to a conclusion that this benefits both of us, you know, type of thing. And so I think it's the point is like it's different to learn it when you're not forced and learn it when you are forced. And I think one's better than the other. Although you're more likely to learn it when you're forced, obviously.
Yeah, and it's like an experience. So it's like
yeah,
you're learning from the experience. It's like you have never dealt it with any kind of things, any kind of situation like that before.
Yeah, like real world experience.
Yeah, and so I think you'll kind of learn faster, and you kind of like learn how to control it through your mind. Like I found that there were effects of anxiety and depression give rise to dementia, cancer, all sorts of phobias, bipolar illnesses, even influenza, varicella, zoster virus, herpes, immune deficiency viruses, maybe.
I have a fun fact for you. You specifically are 10 times more likely to have schizophrenia than I am. Do you know why?
Why?
Because you're an immigrant. So if you're a first generation immigrant to somewhere and you like live there permanently,
Yes.
or, you know, live outside your home country permanently, apparently you're 10 times more likely to have schizophrenia. It's still not very high, but, you know, 10 times increase is pretty significant, you know?
Yeah.
That's quite the number.
Yeah. So it's like I'm trying to recover myself all the time.
That's fair.
Yeah. Because you have all these diseases that arises, and yeah, and even heart disease. But then I actually read somewhere in another book that you know, atherosclerosis, it's a way that the body actually protects yourself from getting harmed from dental bacteria.
Really?
I didn't know this. I didn't know this before.
That's great.
And it in the book it said that like pharmacists don't like actually tell, scientists do not actually tell the public about this, because it's like they have to, because their products won't sell.
Really? Okay.
Yeah. So I was reading this in a book once, and it was actually written by a doctor.
Crazy.
Yeah, it was like so crazy to actually read that. And then after that, because I was in med school, that's why. And yeah, and I was actually looking at it, and I was like, damn, I didn't know this in med school. I thought it was a bad thing, like atherosclerosis.
I mean, it definitely is a bad thing.
But I didn't realize like it protects the body as well.
I mean, it does. The whole, I mean, like if you're a man, and I mean, or any person, but if you're a man, the chance of you having like a large atherosclerotic plaque in your aorta by the time you're like 40, it's like almost 100%. Like, so yeah, I mean, it's just a physiological process that happens. I mean, it's, I could go through the whole thing, which I'm not, because it's boring, but it's like, it's pretty much containing bad stuff. So, I mean, it's kind of like cholesterol. There's good cholesterol and bad cholesterol. Like, it's not all bad. But with that said, a big problem is having too much bad cholesterol. So you want to reduce that, right?
Yeah.
So it's just kind of, it's easier for people to understand that, like, look, this is a bad thing, rather than explaining all the little concepts, because then you have to go to medical school. You know what I mean? And no one's going to do, a few people are going to do that. So yeah, it's easier to just be like, well, this is bad, this is good. Essentially, if you want more details, you can come to us and talk to us more specifically about it. And not only do you have to come to a doctor to talk about it, you probably have to go to a specific doctor to talk about it, who specializes in, you know, cardiovascular medicine, to figure out more about atherosclerotic plaques. You know what I mean? But who gives a crap until it actually happens to you? You know what I mean?
Yeah.
So I think there's things to tell people, and there's things not to, and it's not to be malicious. It's to be like, look, these are the important things you got to know, because I know you're not going to remember everything. It's kind of like when we're in the emergency department, you have someone come in and, you know, you could explain everything there is to know about congestive heart failure to them because they just had an exasperation, but you're not going to do that. They're going to remember 2% probably of what you tell them. And that's not a slight on anyone. That's just how people are. Like, you tell me a big concept that I've never heard of before,
Yes.
I'm gonna know 2% of it. Like, that's just how it goes. So you
Yeah,
tell them the
yeah.
most important things and you repeat them multiple times, and then you have them repeat it to you so that they know, so you know that they know. You know what I mean? That's just how it works.
Yeah, it's like only few people can actually like grasp everything to observing people, and I realized that because all my internships were in the emergency sector. So like I had a lot of old people in the emergency sector, which I would hug all the time and give them like lipid emulsifiers.
You would hug them all the time? Is that what you
Yeah,
said?
yeah,
Okay, just to be sweet.
yeah.
Like, I'm so sorry. That's great. We
Like,
need huggers in the emergency department for sure.
yeah,
Honestly, before we need huggers, we need actual like medical staff. Like, we need nurses. You should see
yeah.
New York. It's insane. Like, we have people waiting like 24 hours just for medical treatment. Like, it's crazy.
Imagine putting like emulsifiers, lipid emulsifiers on them, and then like giving them a hug because it was like painful for them. And then going back to the like nursing sector, and then there's a room for that, and preparing their salines depending on the configuration that you were given to put on the saline jar.
Right.
And then did you like were you able to like draw blood from the patients as well?
Yep. Yeah. So in the emergency department, if you went to school somewhere else, like, I don't know, let's say Ohio or something, you're not, as a doctor or as a medical student, you're not really learning how to do IVs and stuff or draw blood, because it's really just not your job. But I kind of like it in New York, because there's just so understaffed. It's like, look, can you draw blood on this person? Like, it's going to be an hour before a nurse can get to it. So you do it, and it's nice because you get to learn, like, look, now I can do all the steps of the process if I needed to, right? And you might someday. So it's kind of nice. But yeah, I'm getting better at it. I'm like, I'm getting more confidence with it, and it's hard because, like, in New York especially, but the patient's like yelling at you the whole time, so it's kind of a lot of pressure. You're like trying to poke a vein, and they're like, oh, someone else did this better 10 minutes ago, like, it didn't hurt this much, like, you're doing it wrong, like, you had the bevel the wrong way, I know it. And they're just like shouting at you, and you're just like, okay, this is my 5th time ever doing this, and I'm trying to like get this guy's vein, and he's like dehydrated, the blood's not coming, like, the vein is like sprawling around because it's just like this old guy. It's tough. It's tough. But yeah, I'm getting better.
Yeah, the thing is that like I think the first time I did it, I almost put it in too deep. Yeah,
I mean, yeah, you either go too deep or too shallow, or you poke through the vein, and in all those cases you're kind of screwed. I mean, if you go superficial, then you can pull out a little and then go back. But if you go through it, you're just like, oh crap, I probably have to do a whole nother poke, which they don't like, which is fair.
Yeah. And I also experienced it as well, especially people. I'm also afraid of people who are continuously like in X-ray rooms. Like I had this doctor back at
In what? Sorry.
The X-ray rooms.
Oh, in X-ray rooms. Okay.
Yeah, it's like, yeah, there was this doctor back at home, and like he's not going to a separate room when the patient needs to take X-rays, and he's like exposed to the X-rays as well.
Oh, that's foolish.
Yeah, and then he's like, his skin is like
just doesn't
melting.
believe in radiation or
Yeah. His skin is like melting.
It's very strange.
Yeah.
They literally wouldn't even allow that in here. Like, they'd be like, no, I'm not going to take this X-ray unless you move away. Like, that's just so weird.
Yeah, I could like, he was old, but like his skin was like abnormal. Like,
I mean, we try to like hold back radiation as much as possible. I mean, even in like older people-ish, it's like, if we don't need to do this, we shouldn't do it, and then in kids, even if it's like, look, we really, really want to do this, but it's like, okay, exposing radiation is not good at all. We really need to reconsider this, and then reconsider it again. And then we need to defer to like neurology to make sure that they think it's okay too, like, so there's a lot that goes into that.
Yeah. And so how were your teachers in medical school?
Okay, so I can't speak for all medical school teachers. I'm sure there's some amazing ones, at universities, like, especially in the United States. But not that good at St. George's University, but I'm not the greatest student either. And they put us in an auditorium with thousands of students, and then they expect you to listen to this like droning on. But I just don't learn very good that way. So by the end, a lot of people are putting in headphones, not listening to the professor, and studying on their own. And teachers are great and are super important, and I'm not saying that. I'm just saying once you get to that level and you kind of learn how to study on your own, and the professors aren't that good, and there's so many people that they can't teach you specifically, then what are we doing? We need to like just get the info that we need and the way we need it. So for some people it's great, but just not me.
Yeah, like I used to sleep when teachers start teaching in the auditorium. There was
Yeah,
one,
yeah.
yeah, there was one teacher, like I really liked her, but she used to teach the lab courses, and she was like really good. She was the best teacher, but she was only for biochemistry. And I was like, come on. It's like, why can't you be like the rest? Well, why can't every teacher be like you?
Mm-hmm.
Because
Yeah.
she explains every step, and like she starts by explaining the basics. I think that's the most important, because if you don't have the basics right, you don't have a solid foundation to actually learn the entire concept.
Sure. I feel like even when professors did do that, they explained the basics and stuff, it just still like things would go over my head, or it'd be so basic that I would lose track of what's happening, and then I wouldn't be focusing on the rest of the lecture. And a lot of this is my own problems, but I know even like smart people and people who were able to retain stuff, even they would just either listen to the lectures at like 2 times speed while the lecture was happening. They'd listen to a previous one of the one that they just gave, and just like 2 times, 3 times speed, and just crush it. But at the end of the day, they're not super helpful for someone to just repeat things to you. It's better to do spaced repetition and that kind of stuff on your own time. But
So who was your best teacher in medical school? You had a
honestly don't even have one to talk about. There's a couple favorites, but it's not based on what they like kind of taught me. It's more about how entertaining they were on like the stage in my first year. That's honestly all I could say. It's like it's like judging a university based on like the tiling. It's not important, but I didn't get much from the lectures. Like I learned everything from my own like reading and stuff, or even just reading the lectures, but I couldn't get it from them telling me. It's just not how my brain was set up. But yeah, just the ones that were funny. Honestly, the ones that were goofs, that was the best.
And
how about you?
Yeah, so like I just like her because of her way of teaching. I don't know, it just got to me.
Yeah.
I kind of understood everything what she told, and
That's awesome.
The drawings were like super clear, and it's like
Mm-hmm.
a step-by-step pathway to everything you have to learn, and that kind of was advantageous for me in the way she was like explaining it.
Mm-hmm.
So that's why I consider her like one of the best. What about histology? What was your first reaction to it?
Oh man, first of all, I didn't even know what histology was. I was just like, what is this? Like, we're doing microscopes and stuff. I'm like, that's not what I signed up for, and I was so disappointed. But yeah, you just I just started to like memorize stuff. First of all, histology, for people who don't know, it's like you look under slides, you like stain different tissues and different like organisms and stuff under it so that you can see it better. And it's like what pathologists look at and stuff like that. So
it's like a cellular structure.
Yeah, on like a cellular level, right?
Yeah,
and then you can tell different things based on that. And I'm like, look, I just want to do the test and then send it to someone who's going to look at that. Like, I do not want to do this stuff, but it is nice to know, and it's important to learn, just because now you have an idea of what's happening behind the scenes. You're not just sending it to some black box and then the black box send it back with the test result, so that's good. But yeah, no, I was like, I hate this and I never want to do this again. So yeah, that was my reaction.
The first reaction is, how am I going to know?
Yeah, right. Yeah, I'm like, okay, this is a purple blob. All right, so what is it? I have no idea.
Yeah, I imagine. And like even for the exam, like all the specimens were at random, so it depends on what specimen you picked.
Mhm.
And you can't actually see it to the naked eye until you put it on the microscope. And if you get something really complicated, it'll be like,
Mm.
oh my God.
Oh, you guys actually were looking at slides and stuff? We didn't really do
Yeah.
that. It was for us, it was mostly like slides, well, like slide shows, I mean, of the
Okay.
slides. So, I mean, we would just see images of it, and then hopefully they would be pretty clear. But
Yeah.
yeah.
Yeah. Because the thing is that our teacher noticed that we were doing really badly with the specimens, especially in the first month. We were like, oh my God, how like histology is like a completely different subject that nobody actually gets.
Hmm. Yeah, I mean, it's tough. I just don't really care about it, you know. It's just not, it's not like super pertinent to what we're doing, but at the same time, it's good to know, like I said.
Yeah, especially if you find stuff like endoplasmic reticulum or what that is there.
Hmm.
And you don't know what it looks like, and until you actually see it, and then you would say this is part of the liver, this is part of the stomach, and I'm like, what? How do you say this?
Right.
Yeah, that was my first reaction, and then
Mhm.
gradually, like, I got it, and it took like so much of effort. Like I,
Yeah, it's a lot.
it's a lot of effort.
Mhm.
Um, so what are the diseases that can arise from like sleep loss? Aren't we like patients when we are actually studying for med school?
What was the question? What happens from sleep loss or something?
Yeah, what are some kind of diseases that arise from sleep loss?
Oh, I mean, I don't know if there's necessarily diseases that arise from sleep loss. I know, I mean, there's going to be like mental disorders over time if you just
Yeah,
like
yes, that,
never sleep, right? I mean, or if you just like
but yeah,
continuously don't get sleep. But
because we are actually acting like patients when we are in med school.
oh, you mean like because we're getting such little sleep? Yeah, I mean, definitely. I mean, yeah, we're put under great stress in medical school. I mean, there's a reason that doctors, I mean, it's one of the reasons that doctors are respected the way they are or whatever in general by society. But you know, I mean, it could be changed a little bit, I think, but it is important to like go under great stress to to become better, you know. So I get it to a point. It could be done differently, but yeah, I mean, sleep is very, I mean, you definitely realize the importance of sleep once you go to medical school. Like it's
And
very
it's like
important.
you're working like all year round, right? When you're
All year round, yeah, especially if you're an IMG, but I mean, everyone, there's not really a break, right? And then you don't really get the weekend to sleep or something or catch up.
Yeah,
Like you're
and
still
even
studying.
for summer, it's like it depends on what you have. I had an internship during the summer, so
Mm,
it's like everything. Like imagine you were studying the entire year, and as soon as summer comes, you have internship. You had 3 months off, but during the 3 months, you had to do an internship.
mm,
And then for those of them who failed exams, they had to have their two last tries in September.
mm,
And so it was that busy, and every time we had a holiday, like after one term, let's say, it would only be 1 week, so we would be binge watching movies or Netflix TV shows
mm,
just to
mm.
keep up with everything. And then after, yeah, what happened?
Nice. Yeah, I didn't. Yeah, for IMGs anyway, they like expedite everything, so we get like a month off, and like that's our break, and then we come back. So there's no like summer or anything really, but and then it's been crazy with COVID because it's just kind of like messed up timelines and stuff. But so yeah, it's been a wild ride for sure. But I'm glad I went through it. I mean, I've learned a lot about myself and like how people work and how much I can take, you know, and how much any person can take if they like have their mindset right. And you know, it's like something that's, if they like figure out why they're doing something, you know, it's it just, every time, you know, you get to the point where you're like, oh my God, why am I doing this? This is so hard. Like it makes no sense to just keep going. And then you're like, well, if you have a decent why, you know, why am I doing this? Then
Yes.
they can help you like keep going. But it's it's a hard thing to, I mean, that's why there's like life coaches and stuff, like I think you're trying to do and
Yes.
or are doing, sorry. And I mean, it's, once you figure out those kinds of things, and it can be a complicated process, even though it's like a simple thing, like you can really go through a lot and come out the other side and you know, not have like anxiety before the process and
Yeah.
before you do the thing, like, you know, your legs collapsing before an exam. Like
Yeah.
if you have your mindset correct, the, you know, and you're not doing things for the wrong reasons in your own
Yes.
head, like then you can go through anything, you know what I mean? Like I think of I'm looking at this like Crusader guy that's on my desk. When you have like the conviction of like, oh, I think like God is behind me, like I have literally God like telling me that I have to do this, and then if I do it, I'm like given all these rewards, and like nothing can stop me, and like I mean you're gonna walk through a war like nothing can hurt you, right? I mean,
Yeah.
so I mean don't believe crazy things, but like if you can if you can convince yourself of something like that, then you can do amazing things. But
Yeah.
you know, most
Are
of
you
us we can't.
talking about a purpose?
Yeah, essentially a purpose, right? I mean, not all purposes are like you kind of built the same, you know. If my purpose
but
is just to
like,
like chill, then you're not gonna go through
yeah,
much.
like I thought like purpose actually means that something that makes you like fulfilled on the inside. Like you know what makes me fulfilled when I'm like when I was living alone, when I see people outside, homeless people, and you feel like you want to help them, you want to give them some food because they are like they're starving, they're on the streets, and give them your used clothes to the church, and so the church could like donate them to like those are the kind of activities that make me feel fulfilled. And also kind of like lecturing like people who are younger than me to actually not go the way like I started off. Like I started off med school because I was telling them the way I started off med school was completely wrong.
How so?
Because the way like I started, like I was taking med school as an opportunity that okay, when I have reached my higher studies I will be free, and I thought that I will be like fulfilled. But everybody it's a different answer, and I thought I would be fulfilled because I
A
would
lot of people
bring
feel
a
that
lot
way.
of patience. But I felt like I didn't do much as a med student to even help those
You
people.
feel completely useless as a medical
Yeah.
student. You feel like a hindrance to the people
Yes.
around you as a medical student. Yeah, it sucks.
So actually, like, so I would say the way I started off was kind of wrong because not it was not the right reasons for me. So it was like I was trying to get away from home. It felt like that. It's
That's how a
like,
lot of people feel. I mean, yours in a very strong way, but a lot of people feel like, okay, once I get to this, I'll be fulfilled. Once I get to this, I'll be fulfilled. But you know, wait, that's not how it works.
that's not how life works. And I thought that okay, I will finally be independent and free when I'm like in university, and I can maybe get along with people and be in the social circle. And that's not how it played out. And yeah, that was not I wasn't even financially free. Like I was trying to be financially free because I was selling notes from other older students, so that for people who like had crappy teachers and were trying to find out a way out, like but it was for a low price. So I was not like completely financially free. I was like financially independent, yes. So selling notes and like helping them like understand basic concepts before going into more complex. And I was actually talking to them. This is what I did in business school as well. I was giving them a sense of direction, like this is what you should go for, and it's not basically what your relatives think of you, and it should be for your own reasons. It's like it's something you have to answer, not because your mom wants you to be.
Because you had to go through that yourself.
Yeah. It's not because your mom wants you to be this person, your dad wants to be this kind of person. It's actually in this life, it's actually what you want, and you have to figure out what you want.
What makes you feel like you have purpose, right?
Yeah. You're aligned with your purpose.
Did you say are aligned with your purpose?
Yeah.
Yeah, right.
Yeah, so I felt like when I was in business school, like I was getting close to something, but I didn't know what exactly it was. And I felt like I was doing this throughout the entire university because like I was, yeah, my brother. Okay. So, yeah.
Hi, brother.
Yeah. My brother just, okay. So yeah, and when I came to med school, it's like business school from med school, and I realized I was getting closer to something that answers all my questions.
Nice.
And yeah, and I
That's
was
awesome.
kind of like coaching everybody in the university because I know the difference between med students and business students. They're kind of lazier than med students. Yeah, med students work hard. They really work
Yeah.
hard, but
Right.
sometimes they may or may not get the results they expect. But they work really hard compared to the students. I see this
I'll agree
guy.
with that.
Yeah. So this. So what happened in business school was, brother.
Just keep going.
Okay. So what happened in business school was that like I saw like a lot of students and they didn't know what they were doing in life. Some of them just came here because their fathers or parents, they want them to do something in life, and business was the most easiest option for them to go and do. And I
Sure.
felt like most of the students were here just because they had money, and it's just like
Money and expectations to do well. So it's
yeah.
like, look, this is just be compliant on this path to medicine and you'll be good, right?
Yeah, and yeah, I felt like there was a huge difference between the two universities. Huge. And it's like you're with different kind of people, and these people do not know anything about hard work or study. And I found out also that they are very lazy. They're very lazy.
Okay.
It's like, I don't know, like I used to be really annoyed with this guy because I used to work with him, and then he's always dodging the simplest things. Like he would say that it's so hard for me to write an introduction.
Uh-huh.
It's the introduction. Come
Yeah.
on. And yeah, so like I really tried to like coach him and say that and he's not very well matured for his age because he's like 21 and he's still acting like he's like 14.
So I mean, there's you got to admit there's some benefits to what your parents did, right? I mean,
Yeah.
you are obviously very studious and like are hardworking, which most people would agree is a good thing, and etc. But maybe not the best way to go about teaching you those kinds of things. But I mean, you got to admit that there's something there, right?
Yeah, I think my kind of like hard situation sort of was a good thing after all.
Mm-hmm. They like created it themselves, the hard
Yeah.
situation for you to go through. So yeah, it's tough because I mean, let's say you end up growing up, right? You find a husband, you have money, and you do well for yourself, right? Then you have kids. What do you do with them? Do you create a tough environment like you did with like your parents did with you, or do you give them the childhood you wish you had or something, but
I think to make things tough but not so tough like I experienced it.
Sure.
Yeah, kind of lecture them into a good path from the start itself. I think because it's important for them to realize what's more important.
And what is more important?
It's like following their dream, what their purpose is. And it doesn't matter what other people tell them to do. And it might take a while and to realize like what's happy or what makes them happy, but it's their own time. It's their life, and everybody has their own time. I think
that's a reasonable way to think about it. I'm starting to think, I think the same thing, even if it's something that's like not good. Like, even if they believe like, look, I just want to sit in my butt all day and smoke weed. You almost got to be like, maybe they should, like, if that's truly what they think is best, like, all right, as long as you've thought of all the different things and you come to the conclusion that that's the way, like, that's how you want to be, like, who am I to say that you shouldn't? I don't know. It's tough because I also would dislike them, I think, if they did that. And I think an important part of raising a child, I mean, I don't know, I don't have any,
but you have to have
is to teach them to do things, like, to not let them do things that make you dislike them, because then it's gonna be a rough relationship. But so it's tough. It's like, how do you differentiate what is their purpose and what they want to do versus,
Yeah,
makes you not
I
hate
think,
them.
yeah, I think I've put strict rules and stuff.
Yeah,
And
I think you would too.
and yeah, and like out of this whole situation, I kind of had like a multifaceted like knowledge about business and medicine, and I kind
Yeah.
of combined it.
Okay.
Yeah.
Yeah, no, that's cool. I mean, I think I heard in this one guy talking about this one book. We probably should end this pod soon. We've been on a
Yes.
while, but it's called The Unfair Advantage, and he talks about diversifying or like becoming great at many things in your personal life,
Yeah.
but in business or like your profession, being specific as possible. So like you like are fine point in your business because you want to be like the best at your thing, and then everyone comes to you for that, right? But in your personal life, you do not want to just be the best romantic. You know what I mean? You're gonna
Yes.
have rough relationships. You're
Yes.
not gonna be in with touch with your family, all that stuff. Your personal life will suffer, but you wanna like be, you don't want to have any deficits in your personal life.
Yes.
So I heard that and I'm like, oh yeah, that I feel that for sure.
And yeah, so we had to try to balance like each side, the personal life and our work life, because some people also have
Right.
challenges with
But
it.
I think people like really simply say that, like they don't fully comprehend what's being said. So like it's not balanced personal. It's not like, oh, you need to party more. It's not, oh, you need to play more video games because you're working too hard, because that doesn't solve most people's problems.
Yeah.
I mean, some people, maybe the lawyer that works 80 hours a week, but that's very few people.
Yeah.
Like I think it's more so you need to do something that makes you like feel better and correct the deficits in your personal life. I mean, that's the biggest thing. Like it's probably like if you feel awful and you're working hard and you're correcting all these other things, you have a specific thing you're good at in your business and your personal life is very diversified, but you can't like you have no intimate relationships. Like you can't get any boys or girls or whatever you're interested in. Like, I mean, you probably should fix that. Like you probably should put some effort fixing that.
Yeah, I feel like most of the people here, they just care about the intimate side of the relationship than even what they have to do in their own life.
What do you mean?
Like I feel like they are more focused towards something that distracts them rather than something that serves them in their life. And just have a relationship doesn't mean that they should put 100% all the time to the relationship.
100%.
Yeah, you should actually, you have a job, you have a business to do, you have something else to do in your life which needs your attention as well.
Right. And it's not just, oh, I'm having a good business, oh, I have a good relationship or whatever. It's also other things too, right? I mean, if you're like overweight and you hate that about yourself, well, it's like maybe you shouldn't just accept that. Maybe you should change it. Like I know it's tough. It's just, so yeah, fixing the deficits in your personal life, I think it's important. Yeah. But yeah, cool. I mean, it was great talking to you. We should definitely do this again sometime.
Yes,
I think it was fun.
We can actually talk about relationships.
I'm down. Yeah. I mean, here's the thing. I have like a lot to say about that. And it's kind of a thing I went through in medical school as well. And I go on about it in my podcast. Learned a lot of important things that I think would be very beneficial for people. So yeah, no, that'd be nice. Let's talk about that next time.
Okay. Thank you, Trevor. And see you next time.